So I was involved in the first G12C inhibitor in clinic, which was Sotorasib, and which eventually led to approval in G12C non-small cell lung cancer. We just had some very compelling data, both from Mirati and Amgen, on the combination of their G12C inhibitors with either Cetuximab in the case of Adagrasib and Panitumumab in the context of Sotorasib. And, again, tells us that in that context of colorectal cancer, the combination of a G12C inhibitor plus an EGFR antibody can really lead to clinical benefit in chemo-refractory colorectal cancer patients who have G12C, both having high response rates, suggesting for real prolonged clinical benefit in PFS and probably in OS. So it's exciting to see that, since each of these drugs are like my children. You want them to eventually get a job, right? We will see in the presidential session that's coming up, the CodeBreak 200, which is the randomized trial of Sotorasib versus docetaxel in the second-line setting, will likely be, we know it already is a positive study, but everybody's anticipating what exactly is the PFS and overall survival, and so we're looking forward to that. And I'm confident that it will deliver, and the next questions is how do we combine these drugs with other agents such as immune checkpoint inhibitors, other agents that possibly can target the MAP kinase pathway such as SHP2, SOS, etc. The data is very early and immature for us to make final conclusions, but I'm excited about those combinations since I'm involved in many of those trials, and hopefully be back to VJ Oncology to report our results.